It's your old school counselor with breaking news. I don't often do breaking news, but this is really important. I've been fighting for many years to try to save these kids, these questioning kids, or kids that are caught up in the kind of trans situation. And we now have the first medical association to come out and to advise against their surgeons for providing gender affirmation care, or essentially sex change surgeries. The American Society for Plastic Surgery, which is, a terrible name that reflects what we used to refer to those surgeries as, plastic surgery. But the American Society for Plastic Surgery has now come out and advised their physicians against providing these surgeries for children under the age of 19. So, of course, this is massive news, comes on the heels of the first detransitioner lawsuit to be concluded, found in favor of the plaintiff, the detransitioner, for $2 million. She had sued her doctor and her therapist for essentially pushing her into the surgery that is, of course, irrevocable. And she wasn't happy about it. She believed she was manipulated into the surgery, especially by her psychologist, who manipulated her parents by telling her parents that that he believed that if she didn't get the surgery, that she would commit suicide. Although there was no indication of suicide in the clinical space or in the clinical record or in her history. So this appeared to be a manipulation by this therapist, this psychologist, and the court found for the plaintiff. So huge news there, and huge news today that this Plastic Surgery Society is recommending against providing these surgeries. So it's massive. Let me read a little bit of it. Consistent with ASPS's August 2024 statement that the overall evidence base for gender-related endocrine and surgical interventions is low certainty, and in light of recent publications reporting very low certainty of evidence regarding mental health outcomes, along with emerging concerns about potential long-term harms, and the insufficient evidence demonstrating a favorable risk-benefit ratio for the pathway of gender-related endocrine and surgical interventions in children and adolescents. ASPS recommends that surgeons delay gender-related breast, chest, genital, and facial surgery until a patient is at least 19 years old. Okay? Of course, I'm not saying that the surgeon should do the surgery even after age 19, but it's monumental news that they're recommending that their surgeons delay doing it. And of course, this is what we've been saying. The research is out. It's clear. There's no evidence that kids get better psychologically after they have any of these treatments. In fact, the preponderance of evidence suggests that they get worse. So we're, socially affirming, psychologically affirming, and then passing these kids along to endocrine doctors and surgeons to do this permanent stuff to their bodies with no evidence that it will help whatsoever. And the preponderance of evidence we have suggests that it actually makes things worse. So this is what we have characterized as child abuse. So in light of this evidence, which is vast, for any therapist or doctor to still recommend this sort of thing, I don't know what else one could refer to that other than child abuse. That's what this is. We're mutilating children for some maybe political, socio-political, ideological reason, or because there's kind of a cult dynamic at play, and harming these kids forever. So there's something like 25 lawsuits on the dockets now, for detransitioners. This is the first medical association that's come forward. Most likely, other shoes are going to drop over the next several days or weeks, which will be amazing. And my query, I just put it on Facebook with some other therapists. I hardly ever go on Facebook, but I started again because I want to have a forum to be able to talk about this. Which of the 5 professional mental health associations is going to be the first to come out to recommend against gender affirmation on the therapy side of things. So, again, therapists recommending that kids, become trans or move forward towards, physical kind of changes, gender affirmation, as they call it. So the 5 professional associations on the mental health side are the American Association for Marriage and Family Therapy, AAMFT, the American Counseling Association, ACA, the National Association of Social Workers, NASW, the American Psychological Association, APA, and the American Psychiatric Association, also APA. Those are the 5 core mental health associations. Each of them is on record as supporting this sort of gender affirmation thing. So as far as I'm concerned, they are enablers in this dangerous process that's been hurting a lot of children. So which will be the first to come out and say, look, we made a mistake, or we never meant to recommend what we did. Now that the evidence is in, we're retracting that position and we're recommending that our therapists not do this sort of thing, or not get involved in recommending this sort of thing. I can tell you for a fact it will not be NASW, National Association of Social Workers. Potentially it could be either the APAs, most likely would not be ACA. It's possible, since there have always been a few kind of conservatives, maybe in the American Association of Marriage and Family Therapy, which is my former family therapy association, it's possible that they could go first. But we'll see. Of course, there's tremendous pressure from all of these, sex advocacy groups out there to do the politically correct thing. So the only reason they would do it is if they felt they had to protect themselves from lawsuits, or to protect their therapists from lawsuits going forward. So, but I would imagine it's going to happen fairly soon. They all should take a look at what I just published on my website, www.kevinkervick.com. Go to the page that talks about ethical considerations for working with questioning youth. I have a new set of ethical guidelines spelled out clearly that I think could be adopted or incorporated into the existing larger ethical template that I think would shift the field and would give therapists guidance and protect therapists going forward who are trying to do the right things. There are a lot of therapists who really didn't want to do this thing, didn't want to get on board, didn't want to affirm, felt controlled. One even put it recently that she felt patients came in trying to convert her to their way of thinking about the trans thing. And then, therapists kind of went along because they got converted. And there was intense pressure from the community for the therapists to do what they believed these people wanted them to do. Of course, that shouldn't have happened, but I have some compassion for therapists that would go along with something like that because it's very hard. It's very hard to hold the line when you're being inundated and bullied by the entire treatment community that is, ideologically driven and approaching you with a cult-like fervor. Some of these people went along. So this, if you look at my ethical standards, and I think what the big associations should adopt, it will protect therapists that are trying to do the right thing. But most importantly, what this is going to do is to save lives. Save the mental health and save the lives of so many of these children that were pushed down this road that did, irrevocable harm. Probably not saying that word right. Did lasting harm to these poor children. I just read that it's believed that at least about 520,000 children, 520,000 girls had their breasts removed. Had mastectomies since this whole thing started, which is tragic. 520,000 girls had this happen to them. It's possible that a small percentage of those girls, were intersex or, really needed something like this, but it's very likely that virtually all of those surgeries were unnecessary or harmful. So this is a tragic era of child abuse that we've just been through, and I'm glad it's finally beginning to look like we're turning the corner. So in light of the last couple of days in which all of this sort of Epstein stuff has been released, and a lot of people are realizing that, we are living in a mirage, that we're living essentially under a mafia, kind of under the guise that we still have some sort of a representative democracy. We don't. We're living under kind of a mafia, of which Jeffrey Epstein was sort of the key consigliere. At a time when people are realizing that, to get some good news that maybe something positive is happening and professionals are finally beginning to do the right thing is exciting, and it's a little bit affirming. Let me jump off on one quick thing about that, and I will end, and it's related to the Epstein thing. In the Epstein file dump that occurred on Friday, there was several emails from scientists speaking with Epstein about how to encourage or start or fund the trans episode. In other words, in the last 10 years or so, psychologists and scientists came to Epstein and said, we want to push this new trans thing. We think it's a way to change the world. Some of them even said we think it's a way to move towards transhumanism, to end kind of natural law and the natural family concept, and to move towards transhumanism. So the trans situation appears to have been planned and funded by people closely connected to Jeffrey Epstein. And they did it to destroy society as we know it. So anyone who has been impacted by this trans nightmare, or if you were caught up in the cult yourself, or if you think you were doing a good thing, realize that this is a system that was hoisted upon us by these mad scientists, these psychopaths who wanted to change the world. And they pushed it down on us with massive funding, and lots of people made a lot of money off of this whole thing. And people used it to get elected, as their sort of badge of political courage. And all of these children were damaged as a result. So this is a tragic bit of psychopathic criminality that happened to the world. Yours truly is not going to stop talking about that until we can reverse course, start something new, and get justice for all of these victims that endured this awful thing. All right, I guess that's enough for today. Your old school counselor, sometimes I go by Rev Kev. Thanks for watching today.